Nyeri County government has suspended all non-essential services for 1 month in a bid to tame the spread of COVID-19. This coming a day after a senior staff member succumbed to the virus, with 5 others in hospital recovering from the disease. And as Martin Munene reports, this comes even as other counties work to better their capacity to handle COVID-19 cases by increasing oxygen supply to hospitals.
Residents of Nyeri County will have to go for a month without some services as the county government tries to tame the spread of COVID-19 within the county government offices and in the general population. So far, Nyeri County has registered 1,504 cases and 61 deaths. 200 of these cases and 11 deaths have been in the last 1 month. Currently, 28 patients out of 50 in isolation centers are on oxygen. But it is the death of a senior county government staff that has led to the partial shutdown of the county government services. Governor Mutahi Kahiga raising the red flag that things are bad.
The levels are going high, and therefore I would want to take this opportunity to caution all our people to be extra careful. Those of you that may know, yesterday we lost one of our principal housing officers within the county. Through this, he fell sick while outside the county, was rushed here, but before we could save his life, we lost.
Kahiga saying that only critical services will function as usual, but those working in those departments aged above 55 years must work from home, while urging them to receive the AstraZeneca vaccine by the government.
We are going to suspend all non-essential services within the county, and all our officers who are not doing essential services will be asked to work from home.
This even as counties work to better their handling of COVID cases, Nyeri having piped oxygen to an extra 140 beds. In Bomet County, the county government has set up an oxygen plant with a capacity of producing 9,000 litres of oxygen per hour. Bomet Governor Hilary Bachok saying that they have connected all isolation beds with oxygen and are offering support to others.
What we want to request, especially for our private facilities within Bomet, if they are in need of oxygen, so long as they have cylinders, we'll be able to supply. We would also want to extend the same to our neighbors.
In Tharaka Nithi, the county administration has been working day and night to ramp its capacity. This oxygen plant at the Chuka Referral Hospital was put up early 2020 and has been supplying the precious air to the county hospitals and dispensaries. But with increased capacity, Governor Muthomi Njoki says it can supply even the neighboring counties.
See that we can be able to increase our production by doing 24-hour production. And that way we will move from only supplying our health facilities and our private facilities to be able now to help the neighboring counties. So this is my appeal to those neighboring counties who may be having a lot of difficulties in accessing oxygen. Our people in Kenya have no boundaries per se because diseases have no boundaries. And also we find that we have cross-cutting families as per se. And therefore they should not let our people suffer because they have exhausted. Let them get in touch with our CC.
There is no use keeping an oxygen cylinder in your house when you don't need it. So it is important that we come out, those of us who are keeping oxygen cylinders, and give them to our public institutions and private institutions where our COVID patients are going to benefit from them.
Martin Munene, Citizen TV.